pandemic situation like that we are facing right now, the COVID-19, designing an extraordinary plans to face these challenges with a complete protection for our patients and our pharmacists as well. Monitoring the situation and motivating our staff and our colleagues. And finally, communication with the working teams, how we can facilitate the communication between us and between all the working teams. I'll start first with the challenges. First challenge is the no or lack experience among our staff. We don't have a lot of experience that we have to deal with the pandemic situations. So this is the first challenge. Second challenge is facing rumors. A lot of us can hear a lot of rumors coming everywhere. Pharmaceutical care continuation. How can we face how can we ensure the continuity of our pharmaceutical care provided to our patients? Fourth one, securing enough quantities of medications and supplies to our patients. Sending medications to our patients and ensure the counseling process, and it's very important to concentrate on the counseling process because it's very important that all of our patients will know the exact use and how to use their medications, monitoring patients and provide them with their needs. I'll start first with the experience. None of us, I believe, had in his 2019 any nightmare that he can plan for whatever happening in the whole world because of the pandemic and outbreak of COVID-19. So I believe none of us planned for such a situation ahead, or we couldn't plan in 2019 that such a situation will happen. It's a worldwide lack of current possible ways to deal with such situation. The last pandemic or the last general pandemic, it was announced, I believe, with this situation or with a similar situation was in 1920 or early of 19th century. So currently we don't have a way, or the whole world, they don't have a way to deal with such situations of pandemic. Unavailability of guidelines protocol for the best practice or treatment. Till today, there is no best practice or the best guidelines. One day you will find one study that it will support such medications, and then the next day immediately you find another study that it would contradict completely with the previous study. So we don't have guidelines or protocols that it's really available. Infection control and personal protection equipment for pharmacists. Do we really need our pharmacists to protect themselves, or no need? Do we need them to wear the PPEs, or no need? Automatic dispensing cabinets and its presence and disinfection process. Is it really required to use the automated dispensing cabinets, or should we turn it off in the floors that in the isolated floors that we have COVID-19 in it, or should we depend only on the medications sent from the pharmacy directly to the patients? Rumors starting from Yansun, going through vitamin C, vitamin B, aspirin, hydroxychloroquine, azithromycin, and the coronavirus vaccine. All of these rumors. Until today, as I said, that there is no actual and clear and clear treatment or a protocol that anybody can follow exactly with a complete treatment, like any other disease or any other bacterial or viral infection that we may face. So facing rumors that pharmacists, they have a big role and an essential role in it that we need to face. We need to say that this is a fake news, especially those news that's coming through the social media, like WhatsApp, Twitter, LinkedIn, Facebook, all of other Snapchat, all of the ways that we are receiving. So it is our role to increase the awareness among the population and ourselves as well, to really identify the fake news and to go and to proceed and to identify the ways or the sources that we need to really depend on. Continuation of care. This is a very important thing. Clinical pharmacy services, counseling clinics, operation pharmacy services, continuous education for our pharmacists. All of these are very important things. I referred to one of the tweets that it was maybe trending in the last couple of days. He said that they are facing a complete reduction in the number of people number of patients that they are going to the hospital. Is this related to quarantine or the healthy house food? And this is a study that we can conduct. However, for us in the pharmacy, I don't believe that our workload never decreased. However, it's changed. Instead of facing the patient directly in our outpatients, we need now to find ways to reach the patients in their homes with a complete provide of all pharmaceutical care, especially the counseling process for their medications. The normal operational pharmacy service is still ongoing, however, with a complete change of the process in it. Instead of facing the patient in front of the window and counseling him, we should find a way to counsel the patients while they are at home. Supply chain is one of the most important cornerstones in our pharmaceutical process, our pharmacy process, especially during the COVID-19. Supplies and medications needs to reach the patient. I believe that step number one in providing any pharmaceutical care to any patient is to have the medications available with the patient. Then we can go ahead with the second step and the third step and the fourth step in providing pharmaceutical care. However, if the patient does not have the medication with him, and we cannot do anything further, we cannot proceed with any further providing of any pharmaceutical care. So having the supplies inside the pharmacy, having the medications inside the pharmacy and to reach the patient is very essential to all of us, that we need to concentrate, and we concentrated in. As I said, medication delivery is a very essential point. Inability to pick up the prepared medications from the patients from the hospitals, inability to visit clinics, inability to travel between cities and regions. We faced that, especially with certain specialized and referral hospitals, that the patients they used to travel on a weekly or a monthly basis to get their medication or to visit their physicians in the referral hospitals, especially in Riyadh, that it's no longer available. They cannot travel, they cannot leave their city, and they cannot go outside their city to any other region or to any other city to visit their referral hospital. Unprepared delivery companies to face this huge workload. Of course, a lot of our hospitals, they were depending on the delivery companies such as DHL, SAMSA, Saudi Post, Naql, all of those companies. They faced a humongous increase in their workload. So the average number of parcels that it used to be sent from a big hospital, it was almost 500 in the maximum days, or in the heavy days, 500 parcels a day. However, now we reached up to 6,000, 8,000 parcels in a day. Means that 10 times, almost 10 times, more than 10 times increase, 10 to 20 times increase in the workload for those companies. So of course, we faced some kind of delay in the medication delivery to our patients. Patient monitoring. A lot of our patients, such as patients on the anticoagulant like warfarin, they require such lab results. Clozapine as well, Liporex, it requires such lab results. So it was very important that we need to monitor our patient lab results before and after dispensing the medications for them. The results from using a new medication. Did the new medication work as it was supposed to work, or some kind of modification or clarifications needs to take a place before changing the medication, or putting an advice for the prescriber's physician in order to change the medication. The follow-up regarding medications adherence, as we all know that adherence to the medication is very essential and it's very important, that all our patients, we need to make sure that our patients, they are adherent enough to our medications that we are dispensing. So now we came to our planning phase, our changing, how can we plan for such situation. We started by building our experience. We started to monitor and learn from the daily newly published information. Every 2 minutes you can face that new information is coming. So we really need to have a team that they are monitoring and they are really reading and learning from this daily experience worldwide, and we really need to get benefit out of it. Not just only from the worldwide, we need to evaluate our data that it's coming from our hospitals. How can we evaluate this data, and how can we modify the process or the workflow that we are following in our hospitals in order to face and to enhance our pharmaceutical care that we are providing to our patients. Unify the work by creating a unified therapeutic dynamic protocols. Of course, it's a dynamic because a lot of information is coming. As I said, that there is no any definite treatment or prophylaxis or vaccine yet worldwide to treat COVID-19 or the coronavirus, the new coronavirus. So we are working in order to unify. We cannot, in the MOH, we cannot leave it up to each hospital. They have to decide which study that they will follow. Of course, we have to put the best studies, the most strong information about using of any kind of medications. Learn from each other in a different regions. So we have to unify the process. Once we started, for example, in Al-Qatif region, we need to learn what they did, what are the problems that they face, how they overcome those problems, so we will not repeat it again, for example, in Al Medina region or in Mecca or in Riyadh region. we need to document all of this experience. Documenting is very essential. We faced some kind of pandemic situations previously. However, it was not like COVID-19. However, we need to document, especially the failures, before the success. Why we faced this failure? Why it was not a success story that we faced and we failed to manage. So I believe that our learning experience is very essential, and it really depends on the failures before it depends on the success. International data, as I said, every 5 minutes, every 2 minutes, you can wonder if you did not receive a message through your WhatsApp in every 2 minutes regarding a new study, a new information, a new rumor even, a new study that it's coming to say, oh, those drugs can be useful, interferons, hydroxychloroquine, azithromycin, all of those studies coming and then going, acyclovir, all of those studies. So we are really in a situation that we really, as all pharmacists, we need to monitor all of those international data. Therapeutic dynamic protocol, as I said, that therapeutic dynamic protocol, we had 4 versions out of it. Of course, I cannot say that our protocol is to treat. No, this is to manage the treatment and the supportive care that we are providing to our patients with the confirmed COVID-19 infection. Of course, doing this, those are pharmacists and the protocols chaired by our professor, Dr. Ahmed Al-GHAA. And I cannot say that this protocol is the best. However, that our minister, His Excellency Dr. Tawfiq Al-Rabia, he said that this is the first cause that our mortality rate from the COVID-19 infections in Saudi Arabia is almost 0.7%. And I cannot add more.
ورغم ذلك فإننا نبشركم ولله الحمد أن معدل الوفيات في المملكة منخفض جدا، فمعدل الوفيات العالمي يبلغ 7%، في حين أن المعدل في المملكة هو أقل من 0.7%، أي أن المعدل العالمي أكثر من 10 أضعاف المعدل في المملكة، وهذا لسببين رئيسيين. الأول وجود بروتوكول علاجي دقيق وموحد طورته وزارة الصحة السعودية يومي لتحديث البروتوكول بناء على كل جديد في طرق العلاج.
I cannot actually add more than His Excellency's word by putting this the first reason for the low mortality rate for COVID-19 in the kingdom, as well as concentrating in reporting of adverse drug reactions. We concentrated that we are enhancing and we are advising all of our hospitals to report this, and we do not forget it, because reporting of adverse drug reactions, especially with the COVID-19 used medications, will really enhance our experience. And as we all see here, that the Saudi FDA released the April result, and one of our hospitals, they scored the first reporter hospitals, as well as the third reporter hospitals centers for the ADRs in the kingdom. So medication delivery, actually, it is kingdom is a continent. It's very huge. So we started by having a medication delivery home. We are delivering medications to homes. A lot of initiatives came out by our pharmacists and our pharmacist technicians and our volunteers, that they shared the medication delivery all over the kingdom. And by having this, I want to thank them, because they really they did a great job, and they are heroes for having this done in a such numbers that we will monitor right now. Creating a temporary regulations We coordinated with the Saudi FDA in order to increase the dispensing of narcotic and controlled medication for 90 days, and having such companies that it's authorized from the Ministry of Interior to deliver the narcotic and controlled between cities, arranging between all of health care facilities to dispense the narcotic and controlled, as well as coordinating for a regular medication delivery between different organizations, such as the referral hospitals. King Faisal Specialist Hospital, for example, we are coordinating that if we can dispense those items from our Ministry of Health hospitals, we do between medical centers, our referral centers. So, and patients, they can go to the hospitals in their region or in their cities to pick up their medications, especially like the biologics and chemotherapy medications. Creating multiple teams, multiple pharmacy teams. Of course, we advised all of our pharmacy managers to develop such as different teams, so Team A and Team B. So, for example, that if we will have, God forbid, outbreak in one of the teams, we do not close the pharmacy in the hospital. You can isolate, for example, a nursing floor, but if you close the pharmacy, I believe that the whole hospital will collapse and cannot accommodate such a closure in a pharmacy in a hospital. We created an online education sessions, and thankfully, around 8,000 of our pharmacists, they attended those lectures and they got benefit. And most of the lectures were concentrating about COVID-19 and how to advise our pharmacists to deal with such situation and how to protect themselves and how to deal with the automatic dispensing in their facilities. Monitoring and motivating. This is the command control center, and one of the most important things that we are monitoring as a pharmacy, the number of patients that they received their medication or the medication were delivered to their homes. And again, thankfully to all pharmacy heroes that they are doing this, starting from April until today, more than 277,000 of our patients, they received their medications to their homes. And more than 52,000 of our patients, they got benefit from our virtual medication counseling clinics and advices about how to use their medications among the kingdom and all over the kingdom. Those are done by our pharmacy heroes and motivating, working with all possible media to recognize the staff. Our colleagues, they are heroes. They did a lot of activities and initiatives that nobody, I believe, in the whole world did it in a very small time frame. Majority of those hospitals that we are delivering from the medications to homes, they were not utilizing a delivery process before COVID-19. So we started all of this starting from COVID-19. Announce of all achievements, appreciate of all pharmacy heroes, and ask leaders to be an example to our staff. Working with all leaders to solve any problems that it may raise. Communicating. We are communicating daily. As we are facing the COVID-19, I believe that we did not see any kind of weekends. All of the days are weekdays. We are working days and nights in order to facilitate the communication between us and our teams. And we are using the complete technology to ease the communication process. And we are trying to eliminate the communication barriers or the steps that our teams that they have to follow in order to reach the top management. They can communicate directly, and they are more than welcome, and be open to listen to more and new ideas. You cannot imagine how many new ideas and comments are coming, and they are really brilliant ideas. Everybody wants to help. Everybody wants to create. Everybody wants to suggest. So we really need to be, and we were open to listen for all of our pharmacists that they are giving us new ideas. Finally, as a conclusion, it's a totally new experience to the modern world, and we need to work as a one team, and we need to share our experience for the benefit of the mankind. One fact, the world after COVID-19 will not be the same world before the COVID-19, and I believe pharmaceutical care as well, and the pharmaceutical and the pharmacy services will be totally different after the COVID-19. So we need to prepare ourselves to it. Finally, again, I cannot thank enough our heroes, our pharmacy, our pharmacists, our colleague, my brothers and sisters, directors, that they really facilitate all of this happening in the whole world. I am really proud of all of what they did and what they are doing, and I'm really proud to be one of them in one team. Thank you, everybody, and I hope I finished in a correct timeline. I increased 5 minutes. Thank you.